We understand that you're processing a lot of information with your baby right now. I represent a group of doctors and nurses who want to help babies born early, like yours. Your little one has a connection between two main blood vessels coming from the heart, which is called a patent ductus arteriosus, or PDA. All babies have a PDA. It usually closes after they're born. Before birth, the connections allow blood to bypass the lungs, which aren't being used. Babies born early, like your baby, are more likely to have their PDA stay open after they're born. We cannot predict if or when a PDA will close. Some close themselves over time, but some do not. An open PDA may send too much blood to the lungs and not enough to the rest of the body. There is a research study, and it's available to your family, called Pivotal. This study is being done at hospitals across the U.S. Participation is voluntary, and your baby will continue to receive high-quality care whether you take part in the study or not. Pivotal compares two widely used treatments for babies like yours who were born early, have a PDA, and need help breathing using a machine called a ventilator. The two treatments are responsive management and catheter closures. Both are ways of treating a PDA. We do not know which treatment approach is best for infants with PDAs. Both treatment approaches in this study are considered usual care. In Pivotal, your baby will have an equal chance of receiving responsive management or catheter closure. This allows a fair comparison of the treatments. One of the most important things that we want to tell you is that in Pivotal, both treatments aim to lead to the same outcome for your baby, a closed or smaller PDA. All babies who enter Pivotal will be monitored closely. Their health and safety always comes first. The responsive management approach involves treating symptoms related to the PDA as your baby has them, allowing the PDA time to close on its own. In this treatment group, the medical team taking care of your baby will make changes in the amount of fluid your baby's receiving or change the settings on the breathing machine. If your baby's PDA gets larger or symptoms worsen, we will discuss other ways of managing symptoms or closing the PDA. The catheter closure approach involves placing a small device called a piccolo in the PDA to close it. The United States Food and Drug Administration, US FDA, has approved the safety of this device for babies like yours. The device is put in place using a small, flexible tube called a catheter, which is inserted through a blood vessel in the leg and guided to the PDA. If the PDA does not close, we will discuss other ways of managing symptoms or closing the PDA. There are potential risks and benefits to each treatment, which your healthcare team will discuss with you. The overall possible risk and benefits balance out across both approaches in Pivotal. One of the potential benefits of taking part in Pivotal is the close monitoring and examination your baby will receive. This includes extra pictures of your baby's heart to check heart function and blood pressure monitoring in the lungs prior to leaving the hospital at no cost to you. All this information will be provided to your baby's healthcare team. Your baby will also have extra neurological exams as part of the study. These exams may identify early issues with your baby's brain development. These results may also be passed on to your baby's healthcare team and to you. Our passion is helping babies just like yours and improving the care we offer to small babies everywhere, one study at a time. Research is optional, but we hope you consider joining our team in our efforts to learn how to best treat PDAs in babies born early.